Hello, I'm Alan Smith. I'm professor of epidemiology at the University of California at Berkeley. What is epidemiology? Well, we study the causes of disease in people. And today I'd like to share with you findings on the impact of early life exposure, that is, mothers who are pregnant and infants, to arsenic in drinking water, on mortality from cancer and non-cancer causes of death when they become young adults. This work is initiated through the Superfund program at Berkeley, and there are, of course, many Superfund waste sites throughout the country. But in order to study arsenic, we wanted to find new effects that had never been seen before. And to do that, we set up a program of research that was international, studying populations with high exposure to arsenic. Now, why do I study arsenic? Well, here's the atomic table. I learned at high school: hydrogen, heli, bebkanov, nina, miguel, sipskla, akas, as, arsenic. Well, that's Alan Smith. So of course I had to study arsenic, and I've been doing it now for 20 years or more. Well, our group, the Arsenic Health Effects Research Group, is not Alan Smith's research group, as it is often stated. I have to correct that frequently. It's Arsenic Research Group. The associate director is Craig Steinmaus, and here he is in the north of Chile, a remote area, crossing a stream to find people exposed to high concentrations of arsenic in water. And he is the key director of many of our studies now in Chile, where we've made important discoveries. Well, it started from findings from Taiwan. These are lung cancer findings. 1 means no increased risk. It goes on up to villages with higher exposure of arsenic. The highest there in orange, that's 800 micrograms per liter, and their mortality from lung cancer was up to 9 or for women or 5 for men, times higher. Well, that's amazing, I thought. Arsenic in water affecting people's lungs to get high lung cancer rates? Weird. But we decided that we should try to study this. The known causes of lung cancer were all from inhalation at that time. Smoking, of course, asbestos dust. There's a list of them. Even arsenic's on the list from inhalation. These were workers, especially in copper smelters, who were exposed by inhalation to arsenic, and they got lung cancer, but none of these other causes are ingested in drinking water. Well, we then said, now, if the Taiwan findings are real, how big are the risks? At that time, the drinking water standard in the United States was 50 micrograms, that's that UG, per liter. And we estimated that if you drank water at that level for a lifetime, maybe 13 in 1,000 people would die from it. That was extremely high. And in collaboration with Martin Smith, the director of our Superfund program, we've been working on this ever since. Well, firstly, we looked in the United States. Where are there exposed populations? One of them was Fallon in Nevada. There you can see levels in water around about 80 to 90 micrograms per liter, except for 1 year period where it happens that the medical officer of health for the state was fired by the governor for making too much fuss about arsenic. And magically, for a year after that, the arsenic levels were much lower. Well, that's 100 micrograms per liter. We could do studies there, and we have. We've done studies in Nevada and California, and in fact would note that the lost and forgotten arsenic-exposed population are 2 million people who are drinking from private wells in the United States. Where is this population? Well, it's all over the country. Fallon in Nevada is a center of it. There's lots of people with private wells around there. But they're very hard to study. Why? They're scattered, and the numbers aren't very large. There are still very high exposures in the United States, and this is from a project that was done with students where if you look up that vertical axis, that gives you the measurements, and along the bottom, arsenic, and these are private wells in the United States. You can see they go up way above 100 micrograms per liter, and some of them up near 500 micrograms per liter. Some people have put arsenic removal devices, and sometimes they don't work very well. If you look at the top line, we measured water before it goes into the arsenic removal device and after. Now, some of them work well, and you can see the concentration goes way down. Some don't. They have to be maintained. The point, though, is that there are many people exposed, not just from Superfund sites, but from private wells in the United States. Well, we decided we wanted to study populations that had larger numbers exposed, and this is one study in Argentina. That is an old windmill. Somebody who got cancer drank water from that well. Very hard to do these studies. That well is closed, and there are the staff on the research project trying to spin that windmill and get a sample of water for a participant who drank from it 20, 30 years ago. These are some of the investigators at the top right, Dr. Omar Rey, a pathologist who led the study in Argentina. But our main findings have actually come from Chile, or many of them. It's remote. It's actually the driest place on Earth, or driest inhabited place. Some places we go there, you ask them, well, what year did it last rain? Now that makes it wonderful to study because water can only come from certain sources. And here our initial findings for the city of the region 2, actually the whole region in which Antofagasta is the main city. And if you look at the right there, in women at 3.1, in men 3.8, increase in lung cancer overall. This was startling. We got those findings from Taiwan, thought they were weird, went and studied this population, and there they had high lung cancer rates as well. Now, if you inhale arsenic, the risks go up the more you inhale. And in workers, you can measure arsenic in their urine after they inhale it. In the people on water consumption, we can also measure arsenic in urine. Why? Well, 70% is excreted in the urine. So the urine measurement reflects exposure. And there you can see for workers inhaling arsenic, the risk goes up based on their urine levels, but they got it from inhalation. Now, if we do another study with water concentration, this is Dr. Caterina Ferrecho from Chile, then you find the risks go up too, and you can look at the water concentration, then we can put both graphs the same, and what turns out? It doesn't matter whether you inhale or ingest it. What matters is how much gets inside the body, and that's reflected in the urine concentration. So now it started to make sense. Initially it didn't. How could, if you inhale it, get risks and expect from ingestion to get similar risks? Well, it's because the cells inside the lung need to get arsenic inside them before something happens. And whether you get it from inhaling or from ingestion, it's the blood supply that is going to produce the arsenic for those cells. We noted that these cancer risks from arsenic in drinking water at the old standard were actually 100 times higher than for any other drinking water contaminant. Wow. So not only was arsenic in water important, the risks were 100 times higher than other contaminants. This graph plots out risks from various contaminants. I won't tell you about the names. One of them is ethylene dibromide there, that gray one. Those are risks regulated by the EPA. Now, what happens if we put arsenic on this graph in terms of risks? That's what happens. The other ones fade away. Arsenic is far more important in terms of cancer risks than any other water contaminant. The risks, well, at 10 micrograms per liter, 1 in 500 we estimate will die. At 50, it's 1 in 100. At 500 micrograms per liter, 1 in 10. And of course, it's a acute poison. At very high dose, everybody dies. Now, what can we compare those risks to? Well, the only thing is smoking. If you're an active smoker there, your risks of lung cancer are about 1 in 10. If you never smoke and you're married to a smoker who smokes inside the house, the risks are around about 1 in 100. So the only thing out there that we could compare these risks to is actual cigarette smoking. That was another surprise. And arsenic in water looks good. You don't see it there. It doesn't smell, and there's no taste. So these risks are rather unbelievable, and it's taken study after study to convince not only people generally, but scientists that these results are real. The major study, or one of them, was here in Chile, where we looked for 50 years at mortality from lung and bladder cancer. And this was a project, the local director was Dr. Guillermo Marchal from Santiago, Chile. And we published that in the Journal National Cancer Institute. This is what we found. This is for lung cancer among men. And this is for the city of Antofagasta, in the data from Region 2, where that city's in. It starts, see that blue line? It starts with no increased risk. Then the city changed the water supply in 1958. They said, we're getting big, we need a new water supply, and they piped it down from the interior without knowing it had very high levels of arsenic in it. They started finding some effects. So in 1970, they put the world's first arsenic removal plant into operation. What happened to the lung cancer rate? See, they turn up. Those pink things are confidence intervals. Just look at the blue line. Up it goes. Major increased risk. We've looked at various causes of death like this. The latest one was tuberculosis, where it also went up. And for that reason, we're now trying to find and do other studies that will demonstrate whether or not arsenic causes tuberculosis. Now, what about people exposed in utero? That's when the mother's pregnant and in the first few years of life. Well, some of them get this mottling on the skin, pigmentation changes. Very rare, but they can do so. This is a young boy in West Bengal in India. The Chile water comes out of the mountains. It's wonderful temperature. You can sit in it, full of arsenic. It's about 1,000 micrograms per liter there. Then the towns will get this water. When I first went there, they said, well, these two are kept separate because one's got high levels of arsenic in and the other lower. We think the high levels will damage the plant, so we drink that one, and the other one goes for agriculture. So we did studies there with support from the Superfund program in the north of Chile, trying to see if these people had high risks. But this city of Antofagasta turned out to be the most important. 200,000 people. All of a sudden, when they changed the water source, up jumped the exposure. Overnight, it dropped when they turned on the removal plant. One of the things we looked at there was childhood cancers. Nothing much happening. Fortunately, we looked at a rarer childhood cancer, liver cancer. And there, in those years, 1950 to 1957, they were not exposed, but then as young children, they would be drinking this water, and they were dying aged 10 to 19 from kidney cancer at rates there up around 10 times that in the rest of Chile. This was done with our staff here and our collaborators in Chile. What about lung cancer? Well, we can look at people born there just before the peak exposure started, and then look at their later mortality. Or we can look at people born many, many years before that who wouldn't be exposed until they were adults. Well, if they're born 1920 to 38, so their exposure didn't start till they were 30, 40, then, and if we look at the deaths, age 60, 69, the lung cancer risks are increased fourfold. Now, we look at those born closer to when the exposure started. So they had exposure as adolescents, as teenagers. Their lung cancer risks go up to 9-fold or 8-fold. What about those born immediately before? It's even higher. These were babies born who then would drink the water as infants. And then those born right during it, whose mothers would have been exposed during pregnancy, we found had about a 13-fold increased risk in lung cancer. And this was startling to me because nothing like this has been seen before. We can compare this to atom bomb exposure, Hiroshima, Nagasaki. We can compare it to children who grew up in homes where both parents smoked, and the risks from arsenic are much higher. And those are some details from those studies. I won't go into them at this point. You could read them if you like. Ooh, here's another effect. This is a nasty thing. This is a lung, and this is somebody with what we call bronchiectasis. They often die eventually from pus and infection in the lungs. In India, we did a study with Professor Guha Mazumdar where we took X-rays of people with high arsenic in their water and low arsenic in their water, and then compared them. A lot of details on this slide, but basically we looked at those who had arsenic skin lesions compared to those never exposed, and if you go down to the bottom of the slide, we found a 10-fold increased occurrence of bronchiectasis in the lungs. Well, what about lung function? It was also reduced. This is the amount of air people can huff out. So they're not only getting bronchiectasis, they were getting effects in the lung, reducing their lung function. And in fact, the impact in that population in West Bengal, India, was greater than smoking. Smoking damages lung function, and that population, arsenic does it worse. This is now looking back to early life. What about children exposed? This is mortality in young adults, only 30 to 49 years old, and that's chronic respiratory disease. And those exposed in utero in the blue, 15-fold risk. This is the ones their mothers drank it during pregnancy. The baby grew and eventually died, age 30 to 49, with risk 15 times that in the rest of Chile. And if we subdivide that now to bronchiectasis, in other words, we're focusing in on the bronchiectasis, not just all chronic lung disease. And there, that top blue bar goes up to 45-fold increased risk of dying as a young adult after having had exposure of the mother during her pregnancy. None of these findings are due to chance, by the way. There we have these p-values, just says, well, it's less than 1 in 1,000 likelihood this could be due to chance. Now I want to go back to Bangladesh. This is the way we get around. Well, not really, but anyway, behind me is my wife, and one of the things we've tried to do everywhere is do something for these people who are exposed. There in Bangladesh, my wife directs a program of dug wells. The idea is to find water sources with low arsenic, and they construct this dug well, a tube goes in, they pump out water from it with low arsenic, and in fact, then we hope that these children will not be exposed there. And we have done that everywhere we've been. We've tried, not this program, but we've tried to help reduce population exposures. That program is funded by private donors only. It's not part of a Superfund, and there's information on the website there if you'd like to see it. Now, we've also been studying children in Bangladesh, and there's a lot of details on this slide, but basically, currently we have information from over 300 boys and 300 girls. They have varying levels of exposure. We picked them to be children who had exposure during pregnancy. Their mothers were exposed before they were born, and here we were studying them age 7 to 17 and seeing what the effects are. Those are some details. The very poor people, we work out socioeconomic status, and we work out diet and all sorts of other things. But what we focused in on here are children who had high in utero exposure. The mothers were drinking an average of 200 plus micrograms per liter arsenic during pregnancy, some up to more than 1,000. There is the distribution. We have a comparison group, never exposed, that's the left blue bar, and then a distribution of exposure that I've just mentioned. Well, we've been looking at these children. Here's one of them. We're going to huff into a wonderful portable device to measure her lung function. This is with Dr. Yunus and Dr. Fajal in Bangladesh, who are pictured on the left. Here she is. This is the device. There, the investigators worked out this excellent way of doing it. She's going to blow out that candle through this machine. There she goes. Huff. And afterwards, as we always try and do, we give them something for participating. It takes all day for them to be in this study. So there she has a school bag, sort of bigger than her, isn't it? And some cookies to eat. Now, one of the tragic things we found out in this study is that some of these children were actually drinking arsenic at school. The school had the tube wells, and on the left you can see the column goes up to 600-700 micrograms per litre. That's water they drank at school. And I'm pleased to say since then there's been a program to make sure that schools have arsenic-free water. Well, what would we find? We're still working on this. It's hard. We did find evidence of respiratory symptoms in these children. And there you see down to the findings that show increased risk. Some of these children are not able to function as well. They get shortness of breath when walking on the flat. Already then at age 7 to 17, they have these lung effects. Now, what will happen as they grow older? Well, we don't know. We're now seeking further funding to follow them, and in part of our Superfund program, we're able to follow some of these children to see what happens to them now as they get older. This shortness of breath, if you see the risks there, they're markedly increased for some of these outcomes in these children. If you look at that high exposure category, you can see that. And here they're graphically displayed. The biggest finding, surprisingly, was wheeze when not having a cold. These children were more likely to wheeze, and that on the right you can see with the orange, the highest exposures to the mothers in pregnancy, a very high risk, and an intermediate one between. These are ones exposed in infancy. In this study, the baby's born and the mother drank the water during pregnancy, but also after the baby's born, they're exposed. So it's a little hard for us to separate out these effects. Now we look at lung function, and so far these children's lung function is not damaged too much. You'll find here very minor differences. None of them were what we call statistically significant. We think as we study them as they get older, we will find changes in lung function because that's what we found in adults in India. Well, this is just plotting out what happens. This is back to Antofagasta in Region 2. There on the left, the first column is before the exposure started, 50 to 57, that's the baseline. What happens? All of a sudden, mortality from heart attacks goes up. That's the blue line. Then it starts to come down after the arsenic removal plant's put in. And then the purple one is lung cancer. Lung cancer starts to swamp the risk and goes on, and the green ones are bladder cancer. So if you look at this, these risks are commensurate with more than 1 in 10 of these people dying from arsenic in their water. So early life exposure now in heart attacks, we can separate that out. These are young adults dying of heart attacks, less than 50 years of age, 30 to 49 years old. They have a more than 3-fold risk of dying of this very common cause of death, heart attacks, if they had the exposure early in life. Bladder cancer, we can look at that too. SMR there is measuring the risk. There's a 45-fold increased risk for men and 58-fold for women dying of bladder cancer as young adults, aged 30 to 39, after early life exposure. We can look at other things. There's chronic renal disease there, chronic renal failure, and we find increased risks. And in fact, if we look now at the various causes of death we've studied following early life exposure, one of them is liver cancer, kidney cancer, about a 3-fold risk, lung cancer, 8-fold overall, and laryngeal cancer, this is a new finding we're yet to publish, more than 10-fold risk. Bladder cancer, there we go, overall up to 21-fold increased risk, and then there are increased risks from these non-cancer causes as well. And this bronchiectasis one that stands away out, this is looking at them overall. So what does this mean? Well, we never expected to find these things. This is what we found, and it's startling. There's nothing like it, nothing like arsenic and its impact following early life exposure on adult disease. These findings are important. It has major impact on young adult mortality beyond that from any other environmental exposure, and we need to consider information like this when we think of people exposed in the United States, people exposed from Superfund sites, and any other source. An important source of our funding for this work has been the Superfund program here at Berkeley, and in fact, the initial studies started with that as a source of funding. Thank you.